So that's my hemp section. Now I'm going to switch gears, talk about medical marijuana, therapeutic cannabis, and some of the social issues involved. Like hemp, the therapeutic uses of cannabis have been used for thousands of years. We believe it's originated in China, made its way through Asia, Africa, Europe, into the Americas. They recently found a mummified body in the Gobi Desert, 2,700-year-old body. It's buried with 2 pounds of cannabis. It's like, wow, was this a medicine man or a shaman or just a really lucky guy? I don't know, but I want to be buried with 2 pounds. But what we do, so we need we need to understand what they were using it for. We do know that in ancient Rome, they were using cannabis root for pain and gout. It's amazing. And then in the 1830s, an Irish doctor, William O'Shaughnessy, he went to India to practice medicine. And he noticed they were using cannabis for all sorts of things, for pain, to help with childbirth, with spasms and epilepsy. So he documented all these uses, took it back to England, and by 1900, there were dozens of cannabis medicines on the market created by major pharmaceutical companies, including Eli Lilly. So it was really, really popular. Hey, Mike, how's it going? And but the temperance movement kicked in during the early 1900s, and they actually made alcohol illegal in the 20s, and then in the 1930s, Reefer Madness set in. Reefer Madness Act, or Marijuana Tax Act, passed in 1937, and in 1942, they removed cannabis from the Pharmacopoeia, which is a book of all the medicines. They just took it out. It's like, we need to put it back in. And that's why I need your help to do this. Because cannabis is a synergistic solution. It's so good for so many different things. It actually helps fractures heal faster. It's amazing. It's good for nausea. It's good for traumatic brain injury, concussions. Our football players could really benefit from using cannabis. It's good for glaucoma, asthma. It acts as a bronchodilator, which is counterintuitive, but it's really effective. It's good for post-traumatic stress, which a lot of our veterans have. So they fought for us. Hey, Dick. They fought for us. We need to fight for them and provide this safe and effective medicine for our veterans. This brings up the whole issue of comorbidity. This is when people that have more than one chronic ailment at the same time. And it brings to mind the parable of 3 blind men feeling different parts of the elephant. They all think it's a different animal. And that's how doctors treat us now. They look at one specific part of the patient and give you one pharmaceutical, and then look at another part and give you another one, where cannabis can be used to treat the whole patient. So it's very important that we understand that. We have to understand the biology and chemistry of cannabis. This is just an amazing area. Medicinal Genomics is a company up in Woburn, Massachusetts. They're sequencing the cannabis genome and matching it up with the genome and the genetics of individual patients, creating personalized medicine. So the opportunities in this area could be huge. And it's all related to the endocannabinoid system, which is a literal link between your mind and body. You've got cannabinoid receptors all through your body that cannabis interacts with. We have to understand that. We have to understand the terpenes, which is a relatively new area. We have to understand the therapeutic uses, because we know that there are over 50 cannabinoids, different cannabinoids in the flower, cannabis flower. Everybody's familiar with THC and CBD, but there's all sorts of different ones. And it's sort of like if you discover a star, you get to name it. Well, if you discover a cannabinoid, you get to name it. So I propose the next cannabinoid we discover, we call it THL, and name it after Dr. Lester Grinspoon, tetrahydrocannabidiol. That would be an awesome cannabinoid, because it's so helpful for children. This is a very controversial area, but it's just huge, because cannabis is good for autism, children with Dravet's, LGS, and especially epilepsy. And it's great. It's helping so many children. But these parents of these children are going to great risk to provide medicine for their children, or they have to move them across the country. Your health care should not be based on your zip code. And I usually try to wear hemp as much as possible, but I'm wearing a Supernova t-shirt because her mom took her from Texas, moved her to Colorado, and she's doing so much better. And her mom is educating thousands of people about how good cannabis is. And some of these youngsters aren't with us anymore, but we're fighting for them, and we're fighting for the future children. And this is Tuffy. She's a New Jersey young woman with epilepsy that her dad's helping her. So it's good for young people. It's good for old people, present company included. And our population is aging, so it's good for so many things like pain and arthritis, glaucoma, stroke. It helps minimize the effects of a stroke if you can apply cannabis quickly. And our senior citizens are being inundated with pharmaceuticals. Cannabis is a safer, more effective option for so many different ailments. And Alzheimer's and Parkinson's, it's showing a lot of good progress. It removes plaque from your brain cells, so it's sort of like mental floss. But one thing we have to understand is senior citizens vote. They participate in the electoral system. So if we can convince them how good cannabis is and how bad Prohibition is, they'll help us change the laws and make sure we have good laws on the books. So it's very important. Another thing that really affects senior citizens, they're depressed, they're bored, they might be lonely. So should grandma smoke pot? Yeah, why not? Have a little fun. But granny might not want to smoke a fatty. She doesn't have to, because there's so many different delivery systems. And this is another area where we need a lot of research. Which delivery system works best for which ailment? You've got smoking, which is not a bad way, but you're also vaping. Anybody into vaping here? Everybody loves vaping nowadays. Concentrates, topicals, salves, lotions, tinctures, edibles are huge. Juicing, you can juice the entire flower. It's not psychoactive, but you get a lot of cannabinoids. It's awesome. And even suppositories are very effective for a lot of things. So the next time somebody tells you that cannabis is not medicine, you can tell them to literally stick it where the sun don't shine, because it's a good medicine. And it's also safe. We have to drive this point home. There's no lethal dose to marijuana. You cannot smoke yourself to death. And I know some guys that have tried, but seriously though, unfortunately, thousands of people do die every year from opioids, from prescription medications, and over-the-counter drugs. Thousands. It's horrible. We need to switch to cannabis. Our puritanical politicians call marijuana a gateway drug. They say you smoke a little marijuana and then boom, you're going to be doing heroin the next day. When really, it's an exit drug. It can help you get off pharmaceuticals, alcohol. Boston Mayor Marty Walsh calls cannabis marijuana a gateway drug. He's an alcoholic, even though he never smoked marijuana. It didn't make him an alcoholic. But I'm an alcoholic too, and I haven't had a drink in 10 years thanks to marijuana. So marijuana saved my life. It's an exit drug, not a gateway drug. And I feel great. I could lose a few pounds. I used to have a beer belly. Now I got a pot belly, but I'm proud of it. But we need to testify. Get out there and let people know if cannabis is making you more healthy or improving the quality of your life. Tell your doctor. Our doctors are brainwashed. They don't know. Tell your friends, tell your family, let people know, testify. We have to understand the psychology of self-medication. A lot of people self-medicate before work. They might have a cup of coffee and a few puffs, a hippie speedball, and then go to work or go to school with no deleterious effects. But we have to understand that because it's so good for so many things. We have to understand the economics of hemp. We have to understand the economics of prohibition. How much money could be saved if we use cannabis instead of pharmaceuticals? They spend billions upon billions of dollars developing these drugs with these side effects, long list of side effects longer than your arm, when you can grow cannabis for pennies on the dose. In Israel, they provide therapeutic cannabis at cost for $30 an ounce. So that's $1 a gram. That's my price point. That's what I'm shooting for. This brings up another catch 422, though. All the barriers, because it's a Schedule I narcotic, people can't deduct taxes. They can't get access to the banking industry. They can't get loans or process credit cards. Imagine running a business with those restrictions. It's just insane. But the industry is still expanding like crazy, so we're getting around that. We have to look at the custody industry. How many billions of dollars are wasted arresting 600,000 Americans a year, throwing them into the judicial system, putting them on trial, putting them in jail, putting them on probation, drug testing them. It's just amazing. So much money wasted and so many lives destroyed. We have to have rights to use cannabis or to have, we don't want to be fired for testing positive for cannabis at work. It's just not right. Cannabis during pregnancy. It's very good for a lot of things. So women need to have this right. And then the whole driving DUI aspect and impairment brings to mind, it's asymptotic relationship. This is something that Dr. Grinspoon explained to me a long time ago. If you don't smoke marijuana very often, you get really high. You're like a cheap date. But if you smoke every day, you're a lot less impaired. So we have to, the police have to take that into account for roadside field sobriety tests. Just because you have like 2 nanograms of THC in your bloodstream doesn't mean you're impaired. So we have to make sure we get good laws on the books related to that.